Hello, I'm Dr. Mark Dailey, and as many of you know, I am a doctor of chiropractic that specializes in chronic conditions like fibromyalgia, chronic fatigue syndrome, thyroid conditions, and improper gut function of every sort. I graduated from Life Chiropractic College in 1996. I studied and graduated from Functional Medicine University and have advanced education in functional endocrinology, functional blood chemistry, the brain and neurotransmitters, and natural thyroid treatment. Now, I don't treat disease. I get an overall picture of our patient's health through specific lab panels, their health histories, questionnaires, examination, x-rays, and of course past medical history. We then look for deviations from normal from a functional perspective and correct them in a specific order. This is the first video in our mini-series, Gut Health, the Key to Chronic Disease. It would be a very rare occasion for patients with some type of chronic condition like fibromyalgia, chronic fatigue syndrome, or even a thyroid condition not to have some kind of gastrointestinal dysfunction. It's been said that health starts in the gastrointestinal system. It can also be said that disease starts in the GI system. And from my clinical perspective, that is often what I see. With that said, we need to take a very serious look. We need to look very seriously into gut function and how it relates to health and how it relates to chronic disease. Now, I really don't want to bore you with all the details about gut function, but at the same time, I want you to understand how amazing your gastrointestinal system is, how it relates to good health, and equally as important, how it relates to chronic disease. And that's where you come in. So please bear with me while I give you some background. Then we'll talk more specifically about how it relates to chronic disease and good health. But have you ever wondered why people get butterflies in their stomach before going on stage? Or why a job interview could cause an attack of stomach cramps? Or why antidepressants targeted for the brain can cause nausea and abdominal upset in literally millions of people who take those medications? The reason for this is that the body has two brains, if you will. One that's very familiar to you, housed in the skull, and a lesser known but very important one found in the human gut. The two brains are interconnected. When one gets upset, the other one can too. The gut's brain is known as the enteric nervous system. It's located in sheaths of tissue lining the esophagus, the stomach, the intestines, and the colon. Considered a single entity, it is a network of neurons, neurotransmitters, and proteins that send messages between neurons, support cells like those found in the brain, and a complex circuitry that enables it to act independently, to learn and remember, and as the saying goes, produce gut instincts. The brain in your gut plays a huge role in human happiness and distress, and many of you can attest to that. However, very few people know that it even exists. For years, people who had ulcers, problems swallowing, or chronic abdominal pain were told that their problems were imaginary, emotional, or simply all in their heads. They were sent to psychiatrists for treatment. Nearly every substance that helps run and control the brain has shown up in the gut. Major neurotransmitters like serotonin, dopamine, glutamate, norepinephrine, nitric oxide are there. 24 small brain proteins called neuropeptides are found in the gut, as are major cells of the immune system. Inside higher animals like us, the brains are only loosely connected to the central nervous system and can mostly function alone without instructions from the main brain. This is indeed the same picture seen by developmental biologists. A lump of tissue called the neural crest forms early in the womb. One section turns into the central nervous system, which is the brain and the spinal cord. The other piece migrates to become the enteric nervous system. Only later are the two nervous systems connected via a cable called the vagus nerve. Until recently, people thought that the gut's muscles and sensory nerves were wired directly to the brain, and that the brain controlled the gut through two pathways that increased or decreased the rates of activity. The gut was said to be just a tube with simple reflexes. The trouble is, no one bothered to count the nerve fibers in the gut. When they did, they were surprised to find that the gut contains 100 million neurons, more than the spinal cord. Yet the vagus nerve only sends a couple of thousand nerve fibers to the gut. The two brains act in the same way when deprived of input from the outside world. During sleep, the main brain produces 90-minute cycles of slow wave punctuated by periods of rapid eye movement, or REM. That's the sleep in which dreams occur. During the night, when the gut has no food, the gut's brain produces 90-minute cycles of slow wave muscle contraction punctuated by short bursts of rapid movement. The two brains may influence each other while in this state as well, because people with bowel problems have been shown to have abnormal REM sleep, and that's why you perhaps sleep but never feel rested. This finding is consistent with the folk wisdom that ingestion or indigestion can produce nightmares. Now, with this little bit of information, do you think that it's important to talk about the gut and how it relates to chronic disease? Well, in the next video, we're going to get a bit more in depth. It will give you some real insight into your own condition and your own overall health. Now, if you want to take advantage of our free consultation, you remember I offered you a free consultation, which is a $275 value at my expense, costing you nothing. If you'd like to do that, be sure to call our office right away. We do want to be sure to meet the needs of all of our patients, so we only accept 10 new patients each month. So call us right away. Thanks so much for your time and your attention, and I wish you the very best of health.